So we are here today because we want to disseminate the survey, the CAP survey that we did. CAP is Knowledge, Attitudes and Perception Survey. We have called all the stakeholders within the county so that we're able to disseminate the findings that we got and then enrich the survey with the qualitative aspects of the data collection. So we want to also hear from them what they picked from the community. So this survey was done in 345 households across the 9 sub-counties of Kisii County. So we have an understanding that there is a lot of stigma from the synopsis of the survey. We are going to disseminate the report and we are going to give it to the county so that interventions can now be given or be found. And we as an organization want to figure out how we come out of that.
And basically, as the survey, the objective was to look at knowledge, attitude and perception of the people of Kisii County. And this is one of its kind survey that has been done around people who have epilepsy in the country. And very few studies have even been done globally. And this is an opportunity for us to understand how differentiated the misconceptions are, the attitudes, the stigma around the county, which will dictate on the strategies we'll have to put in place to ensure that we improve the care of patients who have epilepsy. And the differentiation has gone to the point of helping us understand which sub-county is more affected and how we can put down targeted interventions to ensure that we get quality of care to these patients.
This morning, we are meeting here at Ufanisi to basically appreciate data that has been collected in regard to epilepsy cases in Kisii. So the team has gathered here to disseminate the same data and find out what are the possible gaps that we need to look at as we wage the war against this disease, which of course in our communities, most people have taken it as a curse, but we know this is one disease that is treatable. The discussion with the KAWE, together with other partners, that is Manager and area, to establish a clinic in Kisii, which clinic will basically be handling epilepsy cases for the epilepsy patients in Kisii. So as a county government of Kisii, as a department, we are committed to ensuring that health services across the county of Kisii are given the necessary support. Our employees, of course, we are continuously subjecting them to training, like what we are doing here today, supporting them so that they can be able to work closely with our people down there, because we know our health workers are the critical cog in fighting any disease that is afflicting our people in the county. We had our partners, PEPFAR, suspending support to county government of Kisii, but today we want to report that that suspension has been lifted, and therefore our employees are back to work. The ones who are supported by the US government, they are reported on Monday, and therefore we want to ask our people that the government is in control and they will continue enjoying the HIV/AIDS-related services that they have been getting for so many years.
Kera kwa nyoriro muntu urwarire endruma kumagakangi wenda gukora ende getangani ensure sayo akumagakera bintu binde mbi yororo igere bichi komo gongo mutu onyeka kumaga gochie sese moye woli ye nyumba mufrute go chagati igera nyore space ngare egera kumagaka aburere wendrume mburi kwambukira nanna buto kwana kera lituko kera kwa nyoriro muntu buno yo mokonya number 3 mba to wasako batebi bagende rochoboka emerengari iri amache gweta abantu abange basirire yakubucha amache agutwara kumagakera amache ari umurinde gweta umurero ryoko ekegenga umurero yoko uwoko monge mundu tabwente koberere byekariko giskuru abantu babwente kumanya kero umwana kumagaka taringani igoreta kisaitani ororo abantu abange basariri abana so we need to understand buri ndrume kubwena bure mburi kwambukira
oborwero bwarentire amachayo ase binyoro nimanyete ndubwata abaminta abange barwarire ngakientambe wa abantu abanene amo n'abana lakini esengencho y'obwoba bw'ekenyoro n'obw'echinka chiri turwete abantu abange bagoteba ng'a gotwara endurumo okunokorogwa oyu n'omonto oragereiri oyu n'omonto osaleti egia asaleti etorega iga emambi ya rero y'okobasarora ng'a oborwaire bw'endurume mbubwata obokonyi naende buna abanyagitari aba barure iga batebire ng'a chisenta busi iga chiabekirwe ao asekere sub county n'abanyagitari mbarororo kamuranche oyo bwate omwana gose mwamata oyo monene ogokwendurume enchere chinde chionsi ngaki chinde chionsi koranche tobasa kwobwa naende tikagosoka naende mono atakugikiria mang'ana abantu bagoteba aye ninto omurwairo anyora ogokonya ase chinyagitari echi twatebire ekiagereria ogondiro nokorwari gunkoro nokogwena nkoro.
Nyangere, I'm a nurse living with epilepsy. Epilepsy is all about conversion. Epilepsy is all about somebody conversing at home, coming to the hospital, being diagnosed, then being given treatment. People at home, barimoreka